Hello, Florida. This is Joe Mullins of the Live Workshop Play Show. And welcome to this weekend. We're going to have a great weekend here in the most beautiful state in the greatest country of the world. And many people, no matter where I travel, always go, "What is it like to live in Florida? It's such an amazing state. You guys are so free. Wow, we'd love to live there. How can we get Florida to teach our state and our area how to be more like it?" So tuning into this show, we tell you how. We're going to tell you how to live, work, shop, and play the greatest way you can and be similar to the great state of Florida. And today we've got some very special guests and we've got a great topic. The topic today we're going to talk about is human health and services. What is going on with our world today? What is going on? Is COVID still around? Are pharmaceuticals companies really in control and running our government and our health services? What is truly going on with our Department of Human Health and Services? Robert Kennedy, he has taken control. He has created a lot of stir and created a lot of chaos in our old way of doing things. Is it good? Is it bad? With me today, I've got Jennifer Galardi. Jennifer from the Heritage Foundation. Jennifer, welcome to the show.
Thanks so much. It's great to be with you.
And then I've got Pastor Jay of Today with Pastor Jay. She's her show, and it's Flagler County resident. When I was county commissioner, Pastor Jay and I became very close friends, started working together, and she actually inspired me to start the show and get information and knowledge out. And these are some of the big things that people want to hear. We want to bring them to them on this show and cover all sides. We want you to hear both sides of the story. Now, being commissioner, one of the biggest challenges that I had and faced was COVID. Jennifer, COVID, where is it today? What's going on? Is it because our administration changed? Now the virus is gone? Are we ignoring it? What is Robert Kennedy doing in this position? And what is going on in our country right now?
Well, COVID's still floating around. I'm not sure what iteration it is, but I don't know if you remember when the war in Ukraine started and all of the attention, CNN, all the mainstream cable outlets went from the ticker tape of reporting the amount of COVID cases at the bottom to the Ukraine story. And I don't remember who said it. I think it was in a tweet, but someone said, "I'd personally like to thank uh, Putin for shifting the narrative from COVID to the Ukraine." That's when COVID ended. As soon as
Yeah.
the Ukraine war started, they didn't have it. They had to shift the narrative to something, to the next disaster. There was never a disaster with COVID. Those lockdowns were a terrible idea. So many people knew it from the start, including our now head of the NIH, National Institutes of Health, Jay Bhattacharya out of Stanford. He wrote the Great Barrington Declaration. Along with a couple other very acclaimed, very highly credentialed uh, academics and doctors, and saying these lockdowns are ridiculous. They're going to cause more harm than they do help. And they were shut down. They were canceled. There were pressure campaigns to, harass them personally and professionally. Some had to leave their posts. So, what's so great about this new Department of Health and Human Services is all of those people from COVID are now in positions of power in the administration. All of the people that got canceled for telling the truth are now in some kind of position of influence within HHS, including Jay Bhattacharya, Marty McCary, Dr. Oz. I couldn't be more excited. I feel like it's a dream team for Health and Human Services, all led by Robert F. Kennedy Jr.
Now, you bring up a very good point, and I got to share this. I was in Atlanta just about 2 weeks ago, and I stayed at a Marriott near the Emory. And Emory does a lot of the disease. A great hospital, great organization in Atlanta. They work with the CDC closely. I was there, and I stood in the lobby, and I saw people from the CDC meeting with them, and I looked up, and they had masks on. And I was like, "Oh my God, not this mask thing again. Oh my God." I dealt with it as a commissioner to the point where I can't stand it. I always brought up points to CDC when I spoke to them. If the mask is really working, what is covering your eyes from getting the germs in it? And they just looked at me and said, "Well, we're not perfect with this. We're just doing the best we can." I said, "Yeah, but y'all are spreading propaganda." You brought up a good point. You said the people that were silenced and pushed away are now in control. I was standing there with him and I thought to myself, These are the same people that are wearing these masks that are far left, excuse me, far right. They were appointed by Democrats or they were hired by Democrats. They were hired by that liberal push and liberal movement that are still up there. And that's why Trump has been so aggressive getting rid of employees because they were implanted. And I thought to myself, these are guys that are going out and telling our country what's safe and what's not. And they're trying to be neutral or trying to be portrayed as neutral, but yet they're very extreme Democrats. Well, here's something ironic. They were all in a Starbucks line, standing about a foot apart from each other with masks on. So what happened to the social distancing, the 6 foot social distancing? Is it okay? Is it necessary to do, but it's okay not to do it when you got Starbucks in front of you?
Well, this was the hypocrisy during all of COVID, right? You could go to a restaurant with your mask on, but you could take it off when you, I mean, none of it made sense. Take your mask off with your eat, but put it on when you go from the hostess stand to the table. Gavin Newsom, we saw he was the epitome of hypocrisy going to one of the most expensive restaurants in California, if not the world, French Laundry, and dining out with no masks, no 6 feet apart. We now know there was no science, no clear data around that mandate, the 6 foot apart mandate. The mask thing was first you don't need it, then you need it. I mean, there was nothing to back it up. So it was all just theoretical. It was all, pardon my language, BS. And they did it for control. And I don't know why people are still doing it. I think they've just breeded a culture of fear in people. They made people afraid of other people. And that is one tool for control. When you fear your neighbor, when you fear your fellow citizen, you're going to be very apprehensive to engage in a discussion with them. You're going to say, you're wrong, I'm right, you're evil, I'm good. And that divisiveness is what we're seeing play out right now. What you probably saw were civil servants. You're not seeing the people in charge. And that's what's really hard about the administration. You've got an entire kind of what they call the bureaucracy, right? Or kind of
Hmm.
draining the swamp. The swamp is the people who are not appointed positions; they're career positions, and so they don't change over when the governments or
Right.
when the executive office changes over. The appointed positions are appointed by Trump, Kennedy, Bhattacharya, McCary, Oz, all of these people. And then they get a couple of people they want in there. But a bulk of the people that work in those departments and those agencies are civil servants. They are career people. And it's very hard to get them out. So when you've got an entire underling, an entire kind of cohort, a base of underlings that are actively trying to undermine what you are doing,
Hmm.
what the country has voted to do, it's really hard to get things done. I mean, I've talked to somebody in HHS that's facing this now. Her very like assistant, the person she's supposed to be able to rely on, is actively working against her. And
Well, and that
and
is
so
so
all of their
true.
time is taken up with just these kind of stupid politics, and they can't get anything done.
Well, I want to ask because we were living in the day of what I call scariants. That's what they call these variants. They had all these different names, but they were really scariants. But there was so many mixed messages coming from the CDC, the FDA, and the NIH that damaged public trust in
Yes.
health institutions. How has the HHS been able to regain the public trust? Because you're just saying right now, we've got these underlings still that's sitting there, right? They have their own agenda. They're not following facts, they're following their own personal objectives. How do we regain? How is HHS able to regain the trust when we've dealt with so many mixed messages before? What are we doing now to make sure that the information that is going out is accurate information that can be trusted by American people?
Yeah, I mean, I think that's exactly what Kennedy has aimed to do when he keeps calling for gold standard science and not politicize science. I think that is one way. But the unfortunate thing is, and we saw this with the Tylenol and autism announcement, that we are so divided right now, particularly the left has such a case of TDS or Trump derangement syndrome that Trump could come out, and you've probably seen the joking memes. Trump could come out and say, I love oxygen. Oxygen is so great. Everyone needs to take oxygen. And you'd see far left progressives put a paper bag or a plastic bag over their head and suffocate themselves. they will cut off their nose to spite their face. So even if good information comes out, which the Tylenol announcement was, listen, that was kind of I believe that created almost a cover for Kennedy, and to prove that there
Hmm.
is no daylight between the executive office, Trump, and Trump's people, and HHS, Kennedy's people, and the Maha movement, because there are people that have been trying to divide this kind of Maha MAGA coalition, particularly the press. And so that way, that was, I think, Trump's way of saying, the Tylenol opened the door, because then he mentioned the Amish study, that there's studies with Amish people that typically don't vaccinate their children and have a much different way of eating and living, and have virtually no rates of autism. So he kind of opened the door to some more controversial ideas around autism. The Tylenol announcement was kind of just a way into that discussion. Um, but you saw after that a bunch of liberal women on TikTok downing Tylenol,
Right.
no
Well,
other reason than they're pregnant. They actually have babies. And why wouldn't you say, take caution, particularly when you're considering a life inside your belly? This is your child. You should take caution with everything: wine, fish, even food. They tell you to take certain cautions with. Why would you actively go against the recommendation just because it's coming out of Trump's office? It's ridiculous
and
to me.
and that's a good question that you're asking, but also, can you just help our listeners understand what exactly is being reported about Tylenol use during pregnancy and the alleged link to autism?
Yeah, well, starting in the 2010s around, there was research that began to raise questions about the safety of acetaminophen, which is Tylenol, during pregnancy. Some studies suggested potential associations between prolonged or high dose acetaminophen use and adverse outcomes such as neurodevelopmental disorders, ADHD, and autism spectrum disorder. And then in 2021, there was a consensus statement published in Nature Reviews Endocrinology, signed by 91 scientists, that called for caution using Tylenol during pregnancy. And again, the statement listed potential risks and urged more research, while advising minimal use at the lowest effective dose. The lowest effective dose, meaning just what Trump said: if you absolutely have to take it, we're not going to say no. And Oz even kind of, tempered his message, because Trump was like, it's not good, right? In Trump's very simple, direct language. And then Oz was on, I believe, CNN or another mainstream media outlet. He said, listen, we're not saying never take it. We're saying use caution. That's what the FDA does. Unless there's an absolute regulation, they give
Right.
advisements. They say use caution. And it speaks to what my colleague Simon Hankinson said on your show earlier, that at some point citizens have to take responsibility for their own health. They can't blame everybody for everything that happens to them. They should sit down with their doctors. That doctor
Hmm.
relationship needs to be primary and restored. And there has to be trust in doctors. And you need to get more than a 15-minute appointment with your doctor to tell them all the things that are going on with you. And then have a discussion about, do I take this, without feeling that doctors are pushing a pharmaceutical on you.
But how do you
We look
balance
at
if
the it's very obvious media and pharmaceutical companies have ran our Department of Health for many years now. All of a sudden, Trump's appointed a man, and he's getting out there and he's saying things that, last year, a few years ago, when I went to Europe, I was mad as I could be because I couldn't get Diet Coke. And I said, I don't want this Coke Zero.
I
And they said,
remember
you're not going
that?
to get it anywhere. And Pastor Jay and I were together there, and I said, Pastor Jay, I got to drink my Diet Coke. I'm going insane. She goes, you're not going to get it. They don't allow that sweetener here. And I said, well, what's wrong with the sweetener? And it's the same thing with a drug addiction or anything else. Once we're educated and we know what we're doing to our system, are we really going to do that? The difference between addiction, going out and trying cocaine or marijuana or something, if we're educated early on, I'm 14 years in sobriety. I really will argue I would have never touched some of that stuff had I known the addictive and the side effects that it would had. All I thought is I was doing something fun, enjoying myself, following a crowd. I didn't know that my personality type, ADHD, was going to fall into that. and loved the drug, and it was going to calm me and become something like Adderall to me, a replacement for Adderall, which, by the way, Adderall is something we prescribe. When I went into treatment, one of the things they said is that's more people are here from the addiction of Adderall than they are cocaine and any other drug combined. So our health department has been very submissive to pharmaceutical companies. We've allowed them to do the narrative. Tylenol, let's face it, it's part of a pharmaceutical company. It is part of what we're
There.
going out there. People think ibuprofen doesn't have any side effects. I took so much ibuprofen, my liver started showing, our kidneys started showing some problems. And I'm sitting here going, but I'm just taking ibuprofen. It's for pain. And I started realizing we go out there and medicate so quick because it's a very profitable way to a segment of our industry or a segment of our country that we don't pay attention to what the health truly is. It's almost like take this drug, it won't kill you as fast as this drug. So we're going to modify, but it'll still kill you.
Well, what's so interesting is you bring up a good point about alcohol. I mean, these are all drugs, whether it's a pharmaceutical drug or caffeine is even considered a drug. One is just
Yeah.
more socially acceptable than the other. We don't regulate caffeine. We don't tell you. We give you as much information, you might have to seek it outside the FDA or HHS, but there's information out there on caffeine. There's plenty of studies. We didn't ban cigarettes. We didn't ban alcohol. At some point we have to let the consumers make the choices for themselves. Now, there's different classifications of drugs, right? You have like cocaine as opposed to marijuana. I think one of the most terrible decisions we've made is in any state is to legalize marijuana. These are all drugs. They all change your biochemistry on some level, whether it's a hormonal level or a energy level, whatever it might be. And we have to use them judiciously. I would love to down 5 cups of coffee a day, a couple of Diet Dr. Peppers, but instead I use this little can once a day.
Ooh, I love
That
Oh,
Diet
is
Dr.
that's
Pepper.
oh
that's my
my
thing.
goodness, you didn't
Tiny
know.
one, right? This is my treat that I allow myself every day because my decision has been I eat really well. I am so aware of my health. I exercise every day. If I'm going out because of Diet Dr. Pepper, well, so be it. I've made that choice. Like I don't expect the government
If
to
you go out because of a Diet Dr. Pepper, I'm doomed
He'll
because
be
I drink
behind. He
probably
will be
20
right
of those a
behind
day.
you.
Yeah,
He'll
I
be right
love that's
behind you.
yeah, that's my
Diet
drink.
Dr. Pepper, no ice.
Oh, it's got to
Imagine
be
that.
really cold though. I can't do
Oh
any
yeah. I
really
have a question because you talk about authority. Shouldn't parents have the ultimate authority over health choices concerning their children rather than federal agencies? And where do we get to a point where there's an overreach? Because you look at the time during COVID, the government shutdowns and all those things. What did we learn from that to moving forward? Whereas states of Florida, like Florida, we were free, but then California, they were absolutely holding children down, inoculating them with these vaccines. Well, they call them vaccines, the poison. So, where do we get to the point where the citizens and parents, we're responsible for our own health choice and decisions and where government overreach lie? Where's that line?
Yeah, you made an excellent point that COVID was actually a wake up call for parents. That and the gender ideology stuff was a huge wake up call for parents. Heritage started a parental rights initiative. We had an entire public event called Shattered Trust based on parental rights and vaccines. I don't know if there is a line. To me, I think parents have the ultimate choice. Now, there is an argument of public safety, okay,
Hmm.
of contagion. If you've got a lot of kids together in a school, MMR, some very serious diseases that they say have been cured because, or not cured, but held at bay because of vaccinations. I mean, when I was young, I asked my mother actually to give me a copy of my vaccine schedule, and there were like maybe 9 or 10 up until the point I was 16. Now it's upward of 35 before you're almost 3. It is out of control. You don't need an HPV vaccine. That should be a choice. The COVID shot should have been a choice from the very beginning. One, because it didn't even prevent the spread, as we know. It didn't do what they said it was supposed to do. So there was no public health argument to make people take that vaccines, adults or children, particularly children who really did not suffer the same at all as adults did, as people with higher rates of chronic disease. I mean, we also saw that with COVID, as the people who were really having a bad time with COVID already had one or at least one or two chronic diseases. So it didn't affect you if your immune system was strong, or I mean, I shouldn't say it didn't affect you. I got it. I was on my butt for a good 10 days, but I didn't die. It's like it was like a bad flu. So, that line of public health and public safety and parental rights, I think needs to be pushed more in the direction of parental rights, unless it's an absolute emergency. Somebody else, I saw a video during COVID, and they're like, if this is an emergency, I want to see people dropping dead in front of me. I want to see people dropping on the streets. That's a public emergency. A cough, a cold, the flu, it's not a public emergency, particularly for children. So it's a fine line, but unless it's really affecting children, that is ultimately up to parents, particularly when it comes to vaccines like the Hep B vaccine and these sexual diseases that are transmitted by sexual intercourse for a 1-year-old.
Wow. That's unbelievable, the way we've allowed media to dictate and narrate and push our society to go. And it's by fear. It's the same thing they used in Germany in the early 1900s. They put fear out there and scared the public. I look at this COVID thing and I think of what we went through as a commissioner and how much when I was a commissioner and how much propaganda was it. I would literally serve on national committees and I would go to meetings in Denver and meetings in California, and I would have counties from all over the country, Hawaii, New York, California, Oregon, say, we're out of money. We need help. We need y'all to send us more money from the government. We're shut down. And I looked at them and I said, Florida doesn't need any money. We're good. We're open. Yeah, but y'all have bodies laying all on the streets and y'all are stepping on them. I said, I just left Florida. I've never in my life stepped over a body. As a matter of fact, if I would walk out and see a dead body on the ground, I think I'd be traumatized to where I wouldn't even be here. I'd be locked up in a place for a few weeks going, oh my God, I stepped over somebody not alive. I said, that is not true. We're allowing media to dictate what our choices are. And that's where our society is headed today, or was headed.
Well, and in the words of George Orwell, and I'll probably butcher this quote, but it's like, don't believe what you see with your own eyes. It doesn't matter what you see with your own eyes. Listen to the government. Listen to what we're telling you. Everybody saw with their own eyes that nobody, the people that were dying and bless their families and their souls that did, they were elderly probably, or they were already sick. I mean, the majority of people were not of good health to begin with. Everybody else was fine. That's what we all knew. We all knew it. And yet they were telling us, be scared, be very, very scared. And the other quote I think of is never let a catastrophe or a good tragedy go to waste. And states like California and states that lean more totalitarian didn't. They took every advantage to control people. And they did it under this guise of safetyism. Right? We're going to keep you safe. And
Now,
people,
Jennifer,
like you said, Pastor Jay, buy into that. When you're
I have a
afraid,
question, Joe.
they buy into it. Yeah.
But how do you balance precaution, right? Erring on the side of safety without avoiding needless panic or overregulation. How do you balance that?
Well, in public policy, that's always the question. The first question should always be, is this the government's role in the first place? You've got an executive office like Joe Biden's, and you've got a progressive leadership. They're going to say everything's the government's job to do. Yes, we must step in. We must do this. In a Trump administration, they're saying no. It's up to you. It's up to you to take care of your own health, make your health decisions. It's up to you whether you want to, I don't know. Give me an example. I'm so tied up with
Take
health.
Tylenol while you're pregnant.
Well, that's a health thing. Yeah, that's a health thing. Like, if you want to do that, we're telling you not to, but go ahead. You always have to judge for yourself. People have to be sovereign individuals. For me, I make my decisions based on my faith. I lean into my faith. I don't lean into the government. Even if the government says, eat 10 to 12 servings of grains a day, refined carbohydrates a day, rice, cereal, pasta. That to me is not true. I don't do it. I haven't done it in the past 20 years. It's terrible advice, but I'm not yelling at the government. we kind of are now trying to change the food pyramid because it's led to such disastrous effects. We've gotten bad advice, but like I always made different choices than what the government told me to do. I did not get the vaccine and I suffered the whatever the consequences of being fired from a job and getting tested every week when I did want to go to work. So, I had to live with those repercussions of my choices. Everybody has to do that. And when it comes to policy, we always have to walk that fine line. Whose responsibility is this? Is this even good for the government to step in? And I'm not saying there's no scenarios where the government can step in, because that is the, you know, downfall of a capitalist society, is sometimes greed will take over. And that's, again, we're going in maybe to some deeper philosophical waters that I like to go into, but you really can't have a free society without, I think, some sort of moral, religious guiding light. It just doesn't happen.
Jennifer, this is such a good topic, and we're at the top of the hour here. Would love to have you guys come back on and we do a part 2. This is amazing topic. We're really bringing out to the public who's running our mental and our physical health. Is it the media? Is it the drug companies, or is it the people that should be running it? I would love to do that more. Now, real quick, how can people find out more information, the listeners of the show find out more information about this topic with the Heritage Foundation?
We just started a new initiative this year called Restoring American Wellness that deals with a lot of these topics. And some of the policy reforms we are recommending, a medical freedom um, kind of act that we're talking about, what you were talking about, Pastor Jay, with medical freedom, right? Kind of right to
Hmm.
choose. Um, we're doing some model legislation around that for states, which is great. We're also discussing the this childhood vaccine schedule, the food guidelines, the FDA food guidelines. We just did a public event, so we're platforming all of these on our Restoring American Wellness initiative at Heritage. That's the team that I am on. And you can go to heritage.org to find out more about that. And all of our public events, people can join virtually, which we'd love to see people learn. A lot of this is going to be a learning curve for people. This hasn't been front and center. Health issues have not been front and center in this way in the government before. They've been front and center as far as Obamacare. How do we pay for it? Right? That's the only question people ask, is how do we pay for healthcare, not what's healthcare doing, and is it targeting the right thing? So it's a huge paradigm shift. It's going to be a big learning curve, not only for the public, but for people in Washington, D.C., who haven't looked at healthcare in this way before, that the way that Kennedy's framing it. And then I'm on some social media channels with my name, either Jen Galardi or Jennifer Galardi or whatever it is.
Jennifer, thank you for joining us, and we're going to go ahead and uh, would love to have you on part 2. So we're going to go do a part 2 if you guys agree. Want to thank our listeners for tuning in today. What an amazing topic! We are really, really onto something big here, and our country is seeing a lot of growth and expansion and movement and waking up. Talking about our prior show about being woke, we are awakening the country to realize what is going on. But I want to thank you for listening this weekend. Have a great weekend in the greatest state to live, work, shop, and play in, the great state of Florida, the model state of the rest of the country. We want to thank you and tune in next week as we have these guys come back. Jennifer Galardi and Pastor Jay come back, and we're going to continue our topic about health, Department of Health and Human Services, and is it being ran by the right group right now? Live, work, shop, play, Florida.